Anaphylactic shock. This presentation is presented by Scholar Mohammed. Anaphylactic shock is the most severe type of allergic reaction and is commonly seen in pre-hospital setting. Introduction. Anaphylactic is a serious allergic reaction, whole-body allergic response in which a substance causes a chemical reaction that can rapidly develop into a life-threatening medical condition. Anaphylactic shock accounts for 400 to 800 deaths per year. Approximately 3% of all cases of anaphylactic shocks are fatal. One of the most dangerous aspects of this type of allergic reaction is the speed with which it progresses. The onset of life-threatening complication can be from seconds to minutes. Emphasis must be placed on rapid, aggressive pre-hospital intervention to prevent death. Agents that may cause anaphylaxis: antibiotics and other drugs, foods, allergy shots, insects, hormones like insulin, blood products, and preservatives. Antigens. It's a medical term for a foreign substance. When antigens enter the body, they cause the release of protective proteins from the immune system. And when the introduction of an antigen causes a violent reaction, it can be called an allergen. Antibody. General term for the protective proteins that are released from the immune system when a foreign substance enters the body. When the body releases antibody in response to an invading antigen, it is called an antibody-antigen reaction. It can be occurred every day, but depends on the substance which is entering the body previously exposed to the substance, and the patient sensitized to the substance. And the immune system reacts more violently because of familiarity to the substance. And it's happening because of excessive release of antibodies. Any symptoms normally accompanying the release of this antibody will be exaggerated. The responsive agents for this reaction is IgE and histamine. And the most responsive for this reaction is histamine, which is released from the mast cells for anaphylactic shocks. Histamine is causing the smooth muscle spasm and swelling. And in the cardiovascular system, it is causing tachycardia with hypotension and arrhythmias. And in the GIT, nausea, vomiting, diarrhea, and cramps. Neurological symptoms: anxiety, dizziness, weakness, and seizure. Cutaneous symptoms: angioedema, edema, urticaria, and itching. From the beginning, swelling of the lips, dyspnea, urticaria, itching, tongue burning, and feeling of the dizziness. Actually, we have to ask about the allergic reaction previously in the patient from the patient. And in the management, we have to respond immediately and make primary assessment because it is progressing so fast. Primary assessment for laryngeal edema, tongue swallowing, and barking cough, swallowing of eyelids and lips are all impending complete airway obstruction. Secondary assessment: a complete head-to-toe survey must be complete, and paying special attention to early and frequent assessment of the vital signs. And checking for urticaria and redness is so important. And checking lung sound because of rapid progression. And actually, we don't have to confuse with respiratory diseases. And the treatment is immediate epinephrine shots, which reverses a lot of effects of the histamine release. This is accomplished by bronchodilation, vasoconstriction, increase in cardiac output. And in this slide, we have the anaphylactic shock treatment with epinephrine and oxygenation and hypnosis. And there is sublingual epinephrine and omalizumab, which is not yet recommended.